And good afternoon, everyone. It is a Fox News alert. We're talking about Wichita, Kansas right now. You're looking at a live shot of a press conference that is about to start there. Why? Because Fox has confirmed that an individual has been arrested now, apparently trying to bomb the Wichita airport. The FBI confirming that it was an undercover operation, a sting that was able to help them in this arrest. More details are coming in now. As you can see, they're coming to the podium. They're about to start this press conference. One individual was apprehended, undercover operation, more details coming, but we do know that right now the people who are going to be at this press conference are U.S. Attorney Barry Grissom, Special Agent in Charge Michael Cast of the FBI office in Kansas City. They will announce today that charges against an individual who was arrested this morning in a case involving a national security matter. We have come to learn here at Fox that that involves some sort of an explosive device at the Wichita airport in Kansas. Stay tuned to Fox as we continue to discover whether or not they're going to actually come to the podium. In the meantime, we're going to move on to our other stories and then come back to this when it is announced. And welcome, everyone, to The Real Story. I am Gretchen Carlson. Let's go back to the White House now, because changing the rules to Obamacare yet again, now extending the enrollment period through the end of the year, December 31st. Meantime, new reaction today from Health and Human Services Secretary Kathleen Sebelius to questions over whether the botched rollout should have cost her her job and if she ever offered that.
At any point during the initial rollout or after the rollout, did you ever offer your resignation to the president?
I'm not going to discuss what I talk about to the president.
Karl Rove is former senior advisor and deputy chief of staff to President George W. Bush. He's also a Fox News contributor. Good to see you, Karl.
Great to see you.
So what did you make of that little question and answer period with Kathleen Sebelius? She said she's not going to discuss what she discusses with the president, but she didn't really answer the question about whether or not she's ever offered to resign. What do you make from it?
Well, she was right not to discuss what she talked with the president about, but you got no sense of remorse from her, nor have we seen any real sense of remorse about it. I thought it was an extraordinary performance when she appeared before Congress recently and directed the Inspector General of the HHS to investigate her. Now, she has no authority to order him to do anything, so this was all for show to make it look like she was calling for an investigation and directing it to be done, but he's an independent authority and does not answer to her, so it was all for show. Well, and I thought added to this sort of circus-like attitude that they have over there.
Well, added to that now, we have more extensions. Now, instead of the deadline being December 23rd, it's the 31st. For people with pre-existing conditions who are critically ill, it's to January 31st. They're also now, the administration, asking insurance companies to kind of, well, I don't know, is the onus now on the insurance companies, Karl?
Well, yeah, look, this was interesting. You're right. They're requiring insurance companies to extend the deadline, which in the law was December 15th. They previously extended it to December 23rd. They're now saying December 31st. Then there was another program called PSIP, Pre-Existing Condition Insurance Plan. About 87,000 people had signed up for it over the last several years, and it's supposed to end by law on December 31st, and they are arbitrarily continuing to the end of January. Now, they're ordering those things to be done. They're urging insurance companies to allow people to pay late. They're urging insurance companies to accept down payments, not full premium payments, but down payments. I'm being very unclear as to whether if you got a $400 premium, if $40 is adequate down payment or $100.
Right.
They're saying that they want insurance companies in January to treat out-of-network providers as in-network providers. And finally, they want in January for insurance companies to pay for any prescriptions that might have been covered by a plan that ended on December 31st, but not covered by the new plan. Now, those
are all urgings, Karl. They're not part of the law, right? They're changes to the law. And back to my original question, it puts the onus on the insurance companies, I don't know, as the bad guys if they don't do it?
Exactly right. Exactly. And look, there's two reasons why they're not going to do this. One is because there's a provision of the law called the medical loss ratio that says that your overhead in an insurance company is limited to 15% of the total amount of premium income you get. So doing things like determining, I'm going to go back and get an out-of-network provider. Was that an out-of-network provider? Does it meet the sort of what the administration urged us to do? That all adds to their costs, and they're limited in those costs, and they get fined if they go more than 15%. 100%. The second thing is some of these things are going to be out-of-pocket costs for the insurer that they're not going to be paid for. If you go to a provider who is outside of your network and you don't necessarily get covered for those costs. Those prescriptions that were covered by an old plan but not the new plan, the insurance companies are going to be picking that up out of their pocket.
And can you imagine that all of these insurance company employees are actually going to be working like triple time through Christmas to the New Year to make sure that all these premiums come in and that they sign up all these people? I mean, when you really start thinking about it, it's mind-boggling that any of it could get done, even with this extension to the 31st. Carl,
exactly.
I got to wrap it up there, but I hope you have a fantastic weekend. Always great details from you. Thanks so much.
You bet.